The positive percentage of new COVID-19 tests in Wisconsin went down slightly today from 2.8 to 2.4%.
Now, the amount of daily testing has varied throughout the month, but the positive percentage of new tests has not gone above 4% since June 4th. Still, there's concern about what could happen, of course, as we get to fall. Dr. Jeff Potoff, Chief Quality Officer at UW Health. We welcome him back to Live at 4.
Hi, Dr. Potoff. Good to see you.
Good to be here, guys. Thanks for having me.
Well, let's talk, I'm always curious to get your take on this because we go out and you start to see people, we broadcast these numbers, things appear to be going in a positive direction, but you don't want people to fall into this false sense of that everything's good, right?
Yeah, I think the important message is the numbers are good because people are doing things that make our numbers good. They're wearing face masks in public. As much as they can, they're social distancing. And it's because of these efforts that we are able to see kind of good results for our state right now.
But, we're in phase 2 right now, and businesses and bars are reopening. And just today, La Crosse County issued a COVID infection warning for 7 bars in La Crosse. So I think it's creating a little bit of confusion. Do you think we're sending some mixed messages about we're opening, or do you think people have a false sense of thinking things are safe and we're getting the upper edge on the pandemic?
Yeah, I think the important message is that we're getting more freedom, we're getting more choice to make decisions, but that doesn't mean that all the choices that we make might be safe for us. So I think, like we've talked about, bars are places where there might be a higher risk of contracting COVID-19 than other areas. We're in close proximity. It's hard to wear a mask. People are yelling or talking loudly. Those are all things that it would make sense that they might have some cases happen in those kind of establishments. So although we're in phase 2, and I think, the data supports we can try this, I think, one, we have to be ready if we need to pull back from phase 2. And also with all of these guidelines, in the small print, but not really the small print, is that we need to do them with appropriate physical distancing. So just because we can have more people together doesn't mean that we can all cram together in a small space. Some of those mitigation efforts, distancing, masking, still apply even in phase 2.
Mm-hmm. We're starting to see, and it's June, but you got to plan well ahead. So education officials are starting to talk about school in the fall. Certainly UW is talking about in-person classes at this point and which ones they can have. What are you thinking as you see these discussions? I mean, how do we move forward? How do these school districts try to grapple with these decisions?
Yeah, I know many of the school districts, those leaders, they're working with public health. They're asking questions of medical experts. And I think it'll be tricky. There's a lot of things that they're going to have to account for that we don't typically have to think about in schools with regards to students wearing masks, staff wearing masks. That might not be so difficult for older students. That could be very difficult for younger students. The idea of social distancing, both in the classroom, but also on the bus routes. These are all things that are new challenges to our school districts. But I think, with enough foresight, enough time, we'll figure out solutions to this. Throughout COVID-19, we've all been required to be a little bit more innovative. And I have faith in our schools that they'll be innovative too and find ways to do this safely.
How are you feeling about the issue of masks? We're still getting a lot of questions about masks, some confusion about whether they're necessary or whether they're making a difference. What's your recommendation for the people that are watching this afternoon?
Yeah, I can understand the confusion with masks. This is one of the recommendations that we as experts did a complete 180 on. In February, we were saying that only sick people should wear masks, that healthy people didn't need to wear masks. And as we learned more about people feeling fine and able to spread the disease and people being able to spread it just by talking, not necessarily requiring a sneeze or a cough, we switched our recommendations. And I think, right now there's even more evidence showing that wearing a mask in public places where you're likely to be closer than 6 feet to other people probably makes a difference. And I think like some other countries, South Korea and Taiwan, we're going to have to start to get more comfortable with the idea that during pandemics, we're going to need to adopt mask wearing in public and not see it as an infringement on our rights or a sign of weakness, but really as a sign of solidarity that we're working together to protect ourselves and our neighbors.
What do you think about travel? A lot of people trying to plan summer trips. Would you recommend people look at how outbreaks are in states and say, hey, maybe this isn't the time to go to Florida?
Yeah, I think I would look at, regional prevalence of the disease. And if you're seeing an uptick or substantial community spread, that should give you pause and think about whether you want to take that risk. And then also plan out your trip to see, how can I preserve physical distancing? How can I ensure good hand hygiene? Am I going to be able to wear a mask where I go? And kind of weigh those risks and benefits and decide whether a certain destination is someplace you want to go to this year, or maybe save that for next year.
Good time for that lonely cabin in the middle of nowhere.
Yeah, exactly.
Dr. Potoff, always great to talk to you. Thanks for your insight.
Yeah, we really appreciate your time.
Keep
Thank
up the
you so
good work.
much, and we'll see you soon.
See you. Thanks.